This election is about healthcare because it illustrates their ace in the hole, the blatant failure of capitalism to address the needs of the people who uh, are said to not be able to afford these luxuries and these necessities of life. A good home, healthcare, all these noble things that people fight for. Fine. Absolutely. Well, that's a perfectly legitimate thing to think, and it's a very noble. And of all my friends, all the Democrats and liberals, most of my friends are Democrats and liberals. You know, great. That is such a noble thing to be thinking about other people, and it really is a great intention. I just want to leave this on you though. I'm gonna make this real short. I remember when I first started thinking about this public versus private healthcare debate and the whole state of the nation back in the 80s. And I remember hearing some quotes about that and wondering the same thing when I was growing up. Like, how how is it that a for-profit system is able to perpetrate itself, propagate itself throughout time when you're dealing with giving out services that cost a lot of money, and you're basically, you're fixing things all the time, and it's not like you can just pull off of a shelf and get a replacement spare part. A lot of these things are labor intensive, and you're working with sick people, and how does a capitalist system even do this? And I remember hearing a stat, like something to the effect of, at its time, it took care of 85% of all citizens in America. 85%. And I thought that was so staggering to me. It really influenced me. And I mean, I understand that there's differences and reasons and things change, but that number really stuck out at me. You know, that a for-profit system can manifest itself in a way, of course, with taxes too, and obviously it's a whole massive economic picture that I wouldn't even try to attempt to explain. But a for-profit system is taking care of 85% of the people. As a percentage, that sounds damn good to me. Damn good, quite impressive, and a true testament to a strong economy and a healthy capitalism. And I just was blown away by that it was even that high. And this notion that the lawsuits haven't driven up the money so much is bullshit. That it's hard to prove that. The these lawyers that can sue doctors for millions and millions of dollars, even if it doesn't, even on paper, if you don't see that many evidences of it, just the fear of it alone will drive up prices. Okay, it's obvious. I mean, you look at the malpractice insurance of all these doctors and these hospitals. The premiums that they're paying is just so far out of this world. It's insane. I don't even know how you would quantify all the effects, the trickling effects of all that, the collaborative effects of those lawsuits and threats of lawsuits. It's mind blowing. Okay, I don't buy. I just don't buy the Democrat and the liberal held philosophy. Not Democrat, but the far left philosophy in it. That these lawsuits are really not that, or like kind of like a drop in the bucket, right? It's just the greedy insurance companies. I don't buy it. I just don't buy it. And 85% can be substantiated through private means alone. So when you talk from a percentage, it doesn't sound so bad, does it? I don't know what the state is now. Maybe it's not 80. Maybe it's 70%, which would suck. But it's still pretty impressive. It's not that low. But if you notice, Democrats never say talking percentages on this. When it's I don't know if there's an adage to this, but it makes sense. If the numbers are in your favor, then talk numbers, right? Right, right. Because it sounds a hell of a lot worse to say there's 40 million Americans without health care, right? Than saying whatever a percentage, right? Right, sure does. Or even better, saying it the other way, like back in the 80s, 85% of Americans do have health insurance and health access to health care, just through private means, right? Right? So I guess we're going to completely dismantle and restructure the system for that 15%, or whatever it is now. So, I mean, if you looked at any other situation out there and said, well, we got our house, 70% complete. We still can't finish the outer trim, the landscaping, the driveway, and everything else. You'd still move into the house, wouldn't you? And you'd still basically carry through. You might have to call a contractor and say, can we work something out, da-da-da-da-off, or go to work, or whatever, right? But you'd still move into the house, and you'd basically carry on. You might do some alterations. You might do some adjustments. You might compensate. You might make sacrifice. You might borrow money. You might raise taxes on your kids by whatever. I don't know. Your rent. Whoever's living at your house. You might charge more rent. I don't know. Whatever. But would you totally just bag the whole thing and rebuild it on 85 or 70% complete? Would you do that? Huh? Would you do that? Especially knowing that a lot of other companies and a whole economy is built around, so far has been built around you making your house. I don't know. Just a question to put out there. And again, I don't know that it's still 85%. But would you say that the system, capitalism is dead? It doesn't work. And you just throw in the towel and go fully socialized medicine on 85%, even 70%. Would you do that? I don't know. Maybe. Maybe you would. Obviously, there's not people that will. But did you know that? Did you get a sense of that? Have you really looked at how high doctors' malpractice premiums really are, and how risky it is to be a doctor now, and how scary it must be? Right? Before you just write off Republicans as being a bunch of bad people, when they're the ones wanting caps from these lawyers, so you should be able to sue, but only for a reasonable amount. Not millions and millions and millions of dollars, right? Whatever, man. Whatever. Go for it. Yeah, I get you. I mean, and I totally agree. It sucks that there's that many people without health insurance. Everybody thinks it sucks. And I'm not just try not to be some hillbilly that just says, yeah, let them do it. If they want it, work for it. I understand that there's people in bad situations, inner city poverty, minorities, you name it, man. It's hard for them. They need help. There's no doubt about it. I don't know, man. How about a voucher? How about a happy medium? How about you make the Democrats and Republicans happy, right? You give everybody in the nation, or you just sub it out by state, and you give everybody a voucher. You look at the typical costs that a really high-end neighborhood would spend on their type of health care, and then versus, lower middle class neighborhood, the average that they spend on health care, whether they have it on their credit card or not, right? But you look at the highs and the lows, and you make a happy medium, right? You draw it right down the middle, by just straight statistics, and then you take that number and you write a check to everybody. Well, not a check, a voucher. You give a voucher to everybody in your state, or do it nationwide, either way. I would say I would do it by state, but whatever. And then you say, look, all right, we're going to make one regulation. We're going to put one regulation on it, right? So you can make the Democrats happy. You can at least get a regulation, right? And the Republicans can be happy because you're not over-regulating. So we're going to make one regulation. No pre-existing conditions. So we're kind of quasi-capitalism here,